Rose, the nursing professor here. I just had to take a few moments to respond to the theatrics that I saw last week in Congress and the drilling of Dr. Anthony Fauci. And so to some, he's being created to be the villain of the pandemic, and to others, he's a hero. So I'm just going to share some of my thoughts. So why did he become the face of America's COVID-19 response? After all, he wasn't the only decision maker. I mean, he was a scientist, he was a physician, he certainly helped us come up with a plan that we did not have in place, all right? But the truth of it is this, is that the government shut down, the governors in each state shut down businesses and schools and things like that. Local leaders set policies. He didn't do that. And public health agencies across the country shaped the response. Now, was he the expert? Absolutely. All right, but he should not be the lightning rod for any why did we do this and all of the repercussions or fallouts that happened as a result of COVID. All right, so he's had over 40 years of experience as one of America's leading infectious disease experts. He's done work on HIV and AIDS, Ebola, Zika, and of course, COVID-19. When uncertainty struck, people looked for him for answers. And here's what many people might have forgotten. The pandemic unfolded in real time. It wasn't like we got notice, hey, the pandemic is coming. Or if we did, we didn't know it, all right? Scientists didn't have all the answers in one day, all right? And so things happened to evolve and change from day to day. And so because that happened does not mean that someone intentionally gave incorrect information. That's just how science works. All right, so one major finding early in the pandemic was that an estimated 25 to 40% of infected people showed no symptoms, yet could still spread the virus. This was monumental in saving lives because that's when the implementation of universal masking happened. Because just imagine when they started doing mass testing, then they found all these positive folk. However, they didn't have any symptoms. So had we allowed those people to still walk around without any mask, then more and more people would have theoretically been infected. All right, so were things perfect? Absolutely not. Did businesses hurt? Absolutely. Did children in schools hurt? Yes. As a university professor, I still see it where many of the high schoolers are not prepared for college, in my opinion. They do not come with the same reading and math skills that they did prior to COVID. All right. So during COVID, one of the things that I remember during COVID was I was working as a community health nurse, and literally when I would walk through a park in Washington, D.C., it was not unusual to see someone dead, all right, literally in the parks, all right. Along with that, the mayor of Washington, D.C. did make a really, really good decision in that, of course, nobody was traveling. So we had these hotels in D.C. that were had all the beds that were available. And so what happened was when unhoused people were diagnosed with COVID and they were okay to be discharged from the hospital, then they were discharged to hotels where there were physicians and nurses who were able to continue the care of these people in the hotels. What this did was it freed up hospital beds so that more acute patients could be taken care of. And so by that decision alone, lives were definitely saved. All right. The 6-foot distancing guideline was based on what scientists understood at the time about respiratory droplets. We knew that droplet precautions were allowing 6 feet between individuals. And so when we went to the store, we had all these little circles to indicate where we were supposed to stand. So, because some of these decisions look different in hindsight, of course. Hindsight is always 20/20. Healthcare professionals reassess decisions every day as new evidence emerges. All right, so think back to the beginning of your career. Do we still do everything that we learned when we first started our career? Nope, we just don't. So that isn't failure, that's learning. That is taking information learned and applying it to current day decision making that needs to be done. So Dr. Fauci also played a critical role in advancing diagnostics, treatments, vaccine development, and antiviral medications like Paxlovid. We didn't have that at the beginning. So all of his decisions were not perfect. No leaders are. But leading through a once-in-a-century public health crisis was never going to be simple. It was not that we had anything to compare it with. Because the truth of it is, the last episode that we had that was somewhat similar had been almost a century before this happened. Now, of course, yes, we had, some flu epidemics in the 1980s and 70s and things like this, but it was not this. So whether you see Dr. Fauci as a hero or a villain, one thing is undeniable. He was a steady voice during one of the most uncertain moments in modern American history. All right. And to that, I thank Dr. Fauci for his years of service, his expertise, and his efforts to help guide millions through an unprecedented pandemic. And so this theatrics, this performative behavior in Congress to act as though he was the only one that could have made these decisions, and he is personally responsible for all the deaths and illnesses and business closings and people wearing masks and people being terrorized by wearing masks is just ridiculous. It is just so ridiculous. All right. And so I thank you all for listening. I just needed to get that off my chest because it's unfair. It really is unfair. So I will see you all next video. I hope this helps someone understand a little bit more about what actually happened during COVID. We all lived through it. If you're over 6 years of age, you definitely lived through it. And so if anything that I hope comes of this is that the lessons learned can be used for a playbook for future episodes, because there are predictions that we will meet this again. So again, thanks for listening. Bye for now.